If you are wondering whether antibiotics are good for you or not, you clicked on the right video. Hi, I'm Dr. Cori Stern. Welcome to my channel, Take Control of Your Health. And I have a wonderful guest with me today who took time out of her super busy schedule. She and I pretty much do the same thing, which is help sick people get well naturally without the use of pharmaceuticals. And this is LaKrista O'Dell. I want you to take a minute to tell us a little bit about yourself.
Yeah, so I'm a registered nurse, and I kind of took a turn into holistic healthcare whenever I was diagnosed with rheumatoid arthritis, lupus, and at that time they were potentially saying Lyme, and the Western medicine world was not helping. And so I took my health into my own hands, which is where I feel like a lot of people that are in this field, how we get here is through our own journey. And so nutrition response testing is what saved me. And so then I, went into that because then that was my passion as to why did I not know about this? And why do more people not know about this? And so that's really what I wanted to do. And that's where we connected as well through there. So just learning nutrition response testing, and that's what I do now full time. So.
Wonderful. Yes. And I picked you out as one of the students that was going to just take it all the way. And I was right. So what she's talking about, nutrition response testing, is not something I talk that much about on the channel, but it is a tool that we use to find out what's going on in bodies and exactly what they need to fix them. And we've been doing this live, and I also can see patients virtually now as well. So let's get started on our topic, which is whether or not antibiotics are something that we should be using for anything. So let's get started talking about a little bit about the history of antibiotics, which just in general, I mean, they were always something like antibiotics have always been on planet Earth. There are things that help to kill pathogens, and they are natural in the environment and in soil and in food. So humans have always used substances to help them to stay healthy and to kill what we now know are, what we call pathogens, creatures that can make us sick. So in the turn of the 20th century, some researchers started trying to actually isolate substances that can help handle certain types of very serious medical conditions. I think the very first medical condition that was being handled by these researchers was syphilis. So syphilis is a sexually transmitted disease that basically ended up killing people, and you don't hear about it too much anymore. And then from there, in the 1940s, the so-called discovery of penicillin, and to present time, there's hundreds and hundreds of different pharmaceuticals that are called antibiotics, which are used primarily for bacterial infections, what
Right.
conventional medicine calls a bacterial infection. And they can be life-saving. Let's be honest about it. They can be if you have sudden onset of a severe or acute infectious process in the body that is beyond the ability for natural to correct it quickly enough to save the person's life. So
Right.
there is a role for it. What else? Is there anything else, LaKrista, that you know of that, besides what I just mentioned, that antibiotics might be helpful for?
So I always, because I am a registered nurse, I use antibiotics a lot. and especially with my young kids. They're 15 and 17. They're 15 and 17 now, but when they were younger, you know, for everything, ear infections, strep throat, you know, doctors threw antibiotics at them all the time. And I just gave them to them because I didn't know that there was another option. But looking back and doing a lot of study on the history of antibiotics, Louis Pasteur did the study on Listeria, and he was never able to actually, you know, on his deathbed, he admitted that a lot of his research was fraudulent. And so then it had me really starting to look at, you know, the germ theory versus the terrain theory, and understanding what are we using antibiotics for, and is that really the right method to go about it? And because a lot of times, you know, doctors even now, and I think parents are a big culprit with this because they take their kids in when they're sick and they don't want to leave without a prescription. And so they're wanting the doctor to give them something, then the doctor feels obligated to hand these out because the kid's sick and the parents don't want to just go home and let a virus run its course. They want something to give them. So they're handing out antibiotics, they're handing out steroids. And there's actually a study that shows if a child is given 10 rounds of antibiotics in their childhood, it increases the risk of non-Hodgkin's lymphoma because we're tanking their immune systems. The microbiome is pretty much set for the most part by the age of 3. And we're wrecking it by giving antibiotics for everything that comes up instead of supporting it. And so I think that's a really huge thing to look at, is really start looking at our terrain and what's around us, not necessarily seeing the germs and pathogens as the bad guys, because we are made of these pathogens. It's just whether or not we can keep them in balance, and whether we can keep those in balance depends on how full our toxic bucket is. So what are you surrounding yourself with? What are you eating? What toxins are you putting on your body? Are you suppressing your immune system? And so that's what we really, I have, my 2 younger kids are 3 and 5. They've never had antibiotics. And my other ones, by the time they were 3 and 5, I had lost count of the rounds of antibiotics. So just knowing that there are other options out there, I think will really empower parents to get out of this. They have to break the cycle. Because when you treat someone with antibiotics, it actually makes you more prone to infection in the future because it lowers your immune system, and then you keep getting repeat infections, and then this cycle continues. And so there is a period of time there that's really difficult to get through, where you're raising your immune system and you're trying to treat things naturally, and you feel like it's a constant battle. But if you can get up that hill, then it's easier and you don't have as many infections, and your body can naturally fight these things off with a little bit of help. And so I think that's where most people need to realize, is if you're stuck in that cycle, you have to break it. And it's not always easy. You've got to get your immune system back to where you're not having these recurrent infections.
You know, I was one of those people. I was raised on antibiotics. I had constant, as a child, oh boy, I'm sorry, my dogs are not cooperating today. Guys, I'm busy now. I'm gonna just hold on 1 second. Sorry, everyone.
No, you're good.
You know what? Why don't you keep talking? I'll be back in a sec.
Okay. Well, I think one of the things that a lot of people don't realize are that antibiotics actually have a lot of side effects. So the most common one is antibiotic resistance. So the more antibiotics you take, the stronger antibiotics that you have to take the next time around, they stop working. And so it actually puts you at risk, because if you do get a bad infection, then you're going to have to take a stronger antibiotic, and it's less likely for that antibiotic to work the more antibiotics that you take. So I was just going over side effects of antibiotics. So antibiotic resistance being a big one, so, if you ever actually need it. And then, like I was saying, disruption of the gut microbiome, which makes you susceptible to more illness. And another thing, when you disrupt the gut microbiome, that's where 80% of your serotonin is made. So on the other side of that, you get people that are depressed and they're anxious, and they start having, psychological symptoms that are they think are completely unrelated. But a lot of these people that are on cyclical antibiotics, like people that take Bactrim all the time to prevent a UTI, they start having depression. Well, because their gut is completely wiped of all the good bacteria.
I've seen that happen multiple times. mostly in young women in their 20s that get put on an antibiotic for whatever, whether it's a urinary tract infection or diagnosis of strep throat or something like that. And they have this sudden onset of severe depression that they just can't shake. And it's just a horrible thing to see. And it actually, when I first started in this field, when I was seeing this happen, I didn't make the connection immediately until I saw it enough times. Wait, there's something in common with all of these young women coming in with either severe depression or anxiety or both. But what I was starting to say before I was rudely interrupted by my wonderful puppies is that I was one of them. I was on antibiotics my whole childhood into my 30s. Into my 30s, I was always sick and taking antibiotics, and I had depression. And one day I just had, this is before I was an alternative practitioner, I had this aha moment. I don't know where it came from. And something told me I needed to stop the antibiotics. And I did. I just cold turkey stopped taking them, suffered through my next, throat pain that I was having. And after that, I stopped getting sick as much. And then once I became a practitioner and I was able to get some real healing done, I never ever took, so I just turned 59. I never ever took another one ever again, ever. So yeah, that my gut biome was destroyed. It took me all of these years to fix it. I'm still in that process. My body was basically trashed as a child and young adult by taking antibiotics. And the other thing that I want to mention is that even when you don't take antibiotics, you're still exposed to them. If you're eating certain animal products that are not pasture raised, grass fed, treated properly. So animals that are raised in confined animal feeding operations are always given antibiotics because the conditions that they're living in makes them sick. And then so cows are mostly shot up with antibiotics in these confined feeding operations. So their meat and their milk is loaded with antibiotics. And studies show actually that if you even live near a confined feeding operation, your groundwater, you're exposed. In fact, there's a higher rate of urinary tract infections in people that live near these confined feeding operations because of the overexposure and killing all the good bacteria and all the good stuff in the gut. And every bacteria live everywhere in your body. Like you're like mostly bacteria.
Yeah.
So, yeah.
They're everywhere.
Yeah, you're bacteria and water mostly, with some skin and bones and other tissue holding you together. So there was some other points that you made, and I'm glad that you brought it up about children, because once you start feeding children properly and supporting their immune system, they don't get sick very much. And if they do, it's very easy to help them get better by supporting their immune system. And this is what we do all the time. You do it with your children.
They're the easiest ones. They're the easiest ones to fix. They're so resilient.
Exactly. Yeah. And the earlier you start, the better off they will be. And I'm going to actually have a guest on next week. I'll have a video with a doctor that specializes in working with children. So we'll be talking more about that. But I actually read a post that LaKrista wrote about antibiotics, which is what made me reach out to her. There were some other really important points that you made. I'm bringing the post up so I can remember everything you said. I should have had that prepared, but life got away from me today. Yes. Oh, you talked about yeast infections. So I
Yeah,
don't
that's
know
a
if
big
you
one.
mentioned that today, but antibiotics killing the good bacteria causes the overgrowth of fungus and yeasts. So yeast infections can affect anyone. The most common one that I see in women are vaginal yeast infections, which I see in a lot of young women. By the way, I just, as an aside, I use boric acid to help people with vaginal yeast infections, and it works amazing. Boric acid suppositories, and you don't need to use any drugs for it. But yeast infections can happen on your skin. They can happen, get fungal infections, athlete's foot, you know, all kinds of places. Jock itch is a fungal infection, right? So people have fungal toenails. It just, when it's on the surface of your body, when it's on your skin or in your nails, it's coming from the inside, and it's so bad that it's just like oozing out. Yeah. So that's one of the risks of overuse of antibiotics. And then I think you mentioned this briefly a lot. You said that a lot of parents want to leave the pediatrician with a prescription for an antibiotic, even if it's a virus. And let's be, you know, very clear about it. Antibiotics don't help with viruses. So a lot of pediatricians will write a prescription just to keep the mom happy, the parents happy, and or with the justification that they're preventing this viral condition from turning into something else.
Right.
But there's so much that you can do to treat things naturally, and we're going to talk about some of those things. Before we do that, I just want to give a shout out to my partner in truth, called HATS, which stands for Hardcore Awakened Truth Seekers Movement. And this movement was inspired into creation amidst hyper political division over the past few years to get away from polarization and bring people together across the political spectrum to the truth and a sense of community, which allows us to move forward. And this movement is making real strides in achieving this vision. They have a huge Telegram channel. If you're on Telegram, the links will be in the description of my video. And they now have a blog as well called hatstruth.substack.com. And I've been posting articles on that blog. There's a lot of really great articles on all different topics. And they also have a store, an online store where you can get cool items like my hat t-shirt and my hat's mug, and everything tastes better out of a hat's mug. And I would love it if you would check them out and support this wonderful organization. So let's see if we can talk about some of the remedies that we can use when people have what seems to be bacterial infections. And I'll let you start.
So some of the most common ones I get asked about are ear infections and strep throat and UTIs. So what I recommend always for ear infections, my kids have had multiple, we've never used antibiotics for any of them, we use a garlic oil. So you can either make this, you can purchase this. The one I make at home, I use a little bit of olive oil, chop up some garlic, simmer it, and then when I cool it down, strain the garlic off and add a couple drops of tea tree oil, put in their ear, and it's usually within 24 hours, the pain is gone. Within 2 to 3 days, the infection's gone. It works a lot faster than antibiotics, and so we use that for ear infections. For strep throat, we use what we call a strep spray is what we call it. So it's just colloidal silver with tea tree oil. That seems to knock out strep within 24 hours really quickly. UTIs are a little bit different. One of the good natural antibiotics that we like to use, and I know you use as well, is the garlic from Standard Process. It's a really potent natural antibiotic. And then there's, other things that go along with that, as far as like drinking a gallon of water with some apple cider vinegar and lemon while you're taking that, and some other natural things you can do. But overall, garlic, tea tree oil, oregano, colloidal silver, there's a lot of really good natural options that my family has been using for years and that have always been really effective for us.
With colloidal silver, it works really well with teeth also. You just spray it on an infected tooth, and
Yes.
especially if you can't get to a dentist right away, but sometimes it just takes care of it and you don't need any kind of intervention. I am going to do a whole other video on urinary tract infections. One of my viewers asked me to do that. So it's a big topic because it's so prevalent. And again, I was one of those people that had them every month. I had a urinary tract infection until I started getting natural handling, and then I stopped getting them. I just want to talk about a few other of my favorite products to handle, let's say, bacterial events in your body. I do want to apologize to everyone for the dogs. I haven't been talking about it publicly, but my husband passed away not that long ago, and he was the one that would take care of the dogs while I was recording videos. And right now I just don't have anybody helping me. So usually they're good, but not today. So some of the things that we use, and LaKrista and I both use them. Oh boy, guys, please. Mama loves you so much, but I really need to finish my video, okay? Sit down.
Throw them snacks. That's what I do to my kids. Throw some snacks.
Yeah, I've done that 4 times already. This bag of bully sticks cost $70, and they're going to practically the whole one today, but that's okay. It's well worth it. So LaKrista and I both use a lot of Standard Process supplements, and I talk about them all the time on this channel. They're my favorite company. You can't go wrong with them. There's something for every situation, and they're made out of food, so anybody can take them. So I'm just going to mention, you mentioned garlic. So the Standard Process garlic forte is enterically coated. So if you're somebody that doesn't want to smell like garlic or burp up garlic, it actually digests in your small intestine rather than your stomach. And that's important because the active ingredient in garlic is allicin. And allicin is denatured by the hydrochloric acid in your stomach. So this particular brand of garlic doesn't get digested. It like gets past the stomach with the coating, and then it gets digested in the small intestine. So it's more effective. And all of these, everything I'm going to talk about, I'm going to put a link to in the description of this video. You just can click on it and you can purchase it. And these are not expensive, by the way. Now, a lot of my viewers don't live in the US. Unfortunately, this company will not ship outside the US, but you just reach out to me and I can get them into your hands. We do this all the time. And I'll put my email in the description. It's questions@drcori.com. So some of my favorite supplements that I want to mention, this is called Congaplex. It comes in a chewable form also for children. And it is, what can we say, a natural antibiotic?
That's usually how I refer to it, yeah.
It just supports the immune system so it could do its job better. And then this one called Thymex is also very similar, but it's a little bit stronger maybe if the situation is ramping up and you need something a little heavier hitting. And then this one, Albaplex, is specifically for bladder, urinary tract, and even kidney issues.
We use that a lot.
Yes, I use this a lot. It's one of the things that actually help me to not have chronic urinary tract infections anymore.
So one thing I want to throw in is the most common antibiotic that they use for kidney and UTIs is Bactrim. And one of the main side effects of that is kidney damage.
Right.
And
right.
so it's almost like it's putting you in a situation to continue to have issues.
Right.
So again, breaking that cycle is really important. And it is tough the first couple times, but it gets easier after that.
Yes. So in my video about urinary tract infections, I will give more tips for handling that. Sometimes Albaplex is not enough, and you know that you mentioned the Bactrim for kidney infection, they increase your risk of kidney disease, is one of my favorite jokes to make about the side effects of drugs. Advair for asthma may increase the risk of death due to asthma. So I'm always like, okay, I don't think I'll take that. So the key to dealing with immune challenges is drainage, because once the pathogens start dying in the body, they release gunk, and that gunk needs to get cleaned out. It needs to get drained out. So we always recommend that you take a drainage support if you're going to take, you know, any of these things that we just mentioned here. So one of my favorite drainages is Spanish Black Radish, and that's all it is. It's Spanish Black Radish. Yes, you can grow it and eat it if you want to. It's like a big spicy radish, but it might be easier just to take these tablets, and it's wonderful for handling things like pus and fluid that doesn't belong there, fluid in the ear, and just drying up gunk in the body. I've seen people with huge infected abscesses that just go away with Spanish Black Radish. It's also one of my dog's favorite supplements. Maybe that's why they were barking at me before.
They can smell it.
Yeah.
It smells wonderful.
They'll eat it as a treat. They'll eat a whole bottle.
It's great for diarrhea as well.
Yes. It does actually detoxify the gastrointestinal tract without causing any kinds of side effects. So it's also good for breast health. It helps to clean up gunk in the breast, right? So I do thermography in my office, which is nice. Alternative to mammography. And with the thermography, you can see a photo of the different areas of heat and anything that's suspicious. And if we see that, and we put the person on Spanish Black Radish, maybe along with some other things, and then we recheck them in 3 to 6 months, and it's gone. It's like a miracle. So I think it helps to prevent cancer. The other drainage that I want to mention, we talked a lot about the need for a microbiome. So one of my favorite probiotics by standard process is called ProSynbiotic, and this is a pre and probiotic. So prebiotic means that it helps to develop the gut environment in such a way that the probiotic, which is live culture, can actually survive. Because if you take a probiotic and your gut environment doesn't support it, it's going to go in one end and out the other, and might cause gas along the way, and nobody likes that. So this is something I use a lot. And then the last thing I wanted to mention is this form of calcium. And a lot of people don't know that calcium is a very important nutrient for the immune system. People, when you say calcium, people think of bones.
Yeah. It activates your white blood cells.
Right. It activates your white blood cells, and it signals the immune system to where the white blood cells need to engulf the bad guys. So calcium is important for your bones, but it's certainly not the only thing. Your bones are made out of mostly collagen, by the way. Your bones are mostly protein, and of course you need calcium, but this is one of the most absorbable forms of calcium and the least expensive. It's extremely inexpensive, and it just is really effective. If you have enough of this in your tissues, Your body won't need to have a fever when you're sick. I never ever get fevers. I take this every day. I never have a fever, no matter what. So this
That's
is
what we
also
give our
good.
kids for fevers too.
Yeah.
The powder form
It
will
comes in a
dissolve
powder, right?
in warm juice or water really quickly, and it will knock out a fever really quick.
Yes. And, people always ask, well, how much should I use? And the answer is, you can't really overdose on it. Yeah. So just keep giving it until the fever's gone.
Yeah.
Yeah. And then it can be used
I'm
as
always
a
like a
preventative.
tablespoon or two.
Right. And maybe do it in slowly, because it doesn't actually taste that great, but
Right. Yeah.
All right. Well, that's all we have for today. I hope this was really helpful. I really appreciate you coming on, LaKrista. Please, if you found this video helpful, please hit the like button. It helps other people to find it. And if you haven't had a chance to subscribe, you could do that now. It would be my reward for putting this information out there. And lastly, and most importantly, if you heard something that you think would benefit someone else, please share this information with them. And until we see you again, stay healthy, everyone.